Well, I was born in Petersburg, Virginia in 1945. My daddy was in Europe as a World War II veteran. He didn't really meet me till I was almost a year old. And we lived in Petersburg for 4 years. At the end of 4 years, I moved to Powhatan County. And at age 12, I moved to Richmond and have lived in Richmond the rest of my life. So I've been in the Richmond metropolitan area for my whole life, and I'm 70 years old. And I've never been away from Richmond more than 2 weeks in my whole life. So you can surely say I'm a Richmonder. Now, something interesting happened. When I was in Powhatan, we didn't have fluoride in the water. And we had a well, and we also didn't have any money. And so, since I didn't have fluoride, I had a lot of cavities. So when we moved to Richmond, I went to the dental school at Richmond. It was called MCV Dental School now, and that's called VCU Dental School. But I was 12 years old, and I needed a lot of work. I didn't have to have any extractions, but I did have to have each tooth have a filling, and I had to have 2 root canals. Now, the dental school was very slow because students were doing their work and students were slow in learning. So I got to go there my whole high school time. And I caught a crosstown bus, went there like once a week, and had my teeth worked on for almost my whole time in high school. And it might take 3 or 4 visits to get one filling done. But during that time, I got to meet, of course, the young dentists who were working on me, which seemed old to me, but they were about 10 years older than me probably. And the professors too, the teachers with their clinic jackets and their authority as teachers. And by the time I was 13 years old, I was convinced that I wanted to be a dentist. And it's kind of a pipe dream because I'm the first person in my family that went to college, much less go further and become a doctor. So I can remember my daddy saying, "Son, don't set your expectations too high," because he didn't want me to be disappointed. He thought I would do fine if I just could get to college and get a college education. But needless to say, I finished dental school and loved it. I'm an unusual dental student in that I didn't dread it and hate it. I loved it. I liked everything I was learning, whether it was pathology or physiology or biochemistry or anything that related to the body is what I was learning. And at the end of my sophomore year, I almost switched to medicine because I was intrigued with the whole body and not just the mouth. But I didn't. I stayed in dental school, and it's a good thing I did too because I ended up just doing exactly what I wanted to do as a dentist. So I set up on my own. I finished dental school in 1970, and I went to work for another dentist who taught me some stuff. You know, the practicing dentist always knew more than the student that just got out of school. And I actually got drafted to go into the Vietnam War, so I had to stop that job to get ready to go to Vietnam, and then Nixon stopped the draft. So then I found another doctor to work for. Then in 1973, which is 3 years, I had 2 years experience working with 2 other experienced doctors. Then I started my own practice at the end of 1973 or early 1974. The second dentist that I worked for was a dentist that really was sharp. He did full mouth reconstructions, which means he worked on all the teeth at one time and really knew the bite and occlusion and joint. And so he was also a natural teacher. And I had him for 2 years, really prepping me to be the kind of dentist I am today. So in 1974, I went into my own place and I started building a practice just like any other young dentist. You know, for about a year, I didn't bring in as much money as I spent, so my wife kept working. And the day that I started making a profit, she quit working and started having babies, and she's a stay-at-home mom ever since, and I managed to keep working and added a new doctor in 74. I started in 74. By 1978, I had a couple doctors. We were growing out of this one space. And so we looked at the demographics, and I went into our second location. And at the end of that, it didn't occur to me I might have a third or a fourth. But I always had a rule that as long as there was demand for my services, I was not going to say no. And so I grew as I needed to keep up with the demand. And to this day, I'm still doing the same thing. I'm 70 years old, and we have tremendous demand. And so now we're building our 12th location, nice office in Chester. And if you ask me, well, what are you going to do after Chester? I would say, well, I don't know. Because all of this that happened to me in my life happened one day at a time. I never had this plan when I finished dental school to be an entrepreneurial dentist or a dentist that grew and hired other dentists and had different locations. I wanted to just be a dentist and make a decent living and have a family, and all of what happened to me happened one day at a time. And I've always taken it one day at a time, but I will say that I've never said no when a patient called and wanted to be seen by me or someone in my group.